And now,
Yeah.
should we move on to onto the lips next? When you're assessing the lips, where do you start with? Are you looking at the structure of the lips or the volume of the lips, or what is your main concern?
So for me, it's the balance. It's the balance of how that lip is sitting in the whole face. So if I think it's just looking fine, even if it was a thin lip, I would just leave it alone. But if
Okay.
that's not sitting well in the whole picture of the face, that's when I even want to address it. But lip is something you could address on every patient who comes to you. A little bit of filler on the lip makes it look beautiful for everyone. Even if you have an already volume filled lip, if you end up doing a little bit, for example, on the center up there, on the center down here, you shift the light reflection from the lip in a very beautiful way. So that makes it look very youthful, very glamorous. But if you have a slightly aging lip, what happens is this white roll on the top starts to either flatten up, and then the body itself becomes a little more less voluminous, and then the support of the teeth as you grow older becomes lesser, and the bony support underneath also goes lesser. So the lip tends to kind of go that way. It just
Yeah.
turns inward, it loses support. So a lot of patients come and tell you that, doc, when I was younger, I used to have much fuller lips and now I don't. I'm not even a smoker. So it's got nothing to do with your smoking or your lifestyle habit. It's simply because the bony support underneath is changing, the dental support underneath is changing, the volume of the lip itself is changing, and the white roll begins to flatten out. So then what I do is I first go and work on the white roll to give it that structural support.
Oh,
Then I end up working on the body of the lip to give it more volume. Basically, you're trying to evert that lip, which is now kind of inverted and gone flat. So that's the way I would approach it. And then if you do have smoker's lines, whether you're a smoker or not, can happen as you grow older because the muscle there kind of tends to work a lot and the fat on top of the muscle becomes less. So now the muscle is more visible under the skin. So what we end up doing is using a little bit of fillers, hydrating ones just beneath the skin, very little bit of it in a very thin layer to give that little cushion which they have lost because the fat is lost. And then I give little Botox, like maybe a 1 unit and a 1 unit right there to take away that the smoker's lines. It also helps me evert the lip beautifully well. But for all those beginners who are watching this, my only advice is when you're doing those, don't go too near to the Cupid's bow or to the philtrum. You will tend to flatten that, and that's not aesthetically nice. So your first injection is as far as you can, and then the second below there, just about the white roll. That's how you would inject the toxin.
okay. It is a very delicate balance, isn't it? And so
Yeah.
of the face that those lips are sitting in as to where you want to take it. I mean, do you have many patients who, like in the UK, just want bigger lips the whole time, or do they leave it to you?
India is a little conservative in that manner. So they wouldn't like people to know that you have done anything on your face. So they like a very subtle, very natural result. So it's always that balance of, yes, they still want that oomph and that little fuller lips, but nobody else should tell. So that's a very difficult balance for us to play here. But there are the
Okay.
younger generation now who are happy to kind of flaunt the nicely done lips.
Yeah. Okay. Very, very much the same here. The doctors here tell me that, yeah, anybody over 40, um, they're incredibly cautious around injectables, but anybody under 30 just walks in here and says, I know you do this. I want it. Treat me now. And it's
Yeah,
like,
yeah.
could we at least have a chat
Yeah,
about this and
yeah,
why you want it? And there seems to be a lot going on in there. But at least if your patients are on the conservative side, then it's easier to educate them, I should think,
true.
around why you're doing what you're doing, rather than because you. There was a question somewhere, not on here, but about whether you had a standard amount of lip filler that you used. And I thought you can't ever have a standard amount of lip filler, can you?
No, but I tend to go somewhere between a zero point 0.5 ml to a 1.5 ml. Like
Okay.
I don't think I've used maybe 2 ml ever. I'm very conservative when it comes to lip. It's usually zero point 0.5 to 1 ml. Very rarely that half extra is something I might and more, but you can't take away.
Okay, thank you. And
way after that.
No, no, you can't. Always, always the argument for a conservative treatment. And do you use other techniques to help address the crepiness and those smokers' lines in this area? I was hearing about how some clinics here are starting experimenting with the injectable moisturizer type of treatment. So Volite,
Yes.
the Profile
Yes,
density.
they could. Yes. So it would really work wonders if you just help the moisturizing and simply, whether it's an HA or any other compound used to moisturize, the needling itself there will stimulate some collagen and make the skin much more thicker, collagen regenerate in that area. You could simply use a PRP. You could simply use a microneedling without even any material in it. Or you could combine them with hydrating injectables. Those really give a lot of advantage.
Yeah, microneedling, that often gets forgotten in all the excitement of all,
Yeah,
doesn't it?
yeah.
But it's a really good treatment for so many concerns in the face, isn't it?
Oh, I love it. I think it's that good old gadget, which is, like you rightly said, lost its sheen in front of all these sophisticated equipments. But then for me, microneedling does wonders, right from acne scars to skin rejuvenation to stimulating your collagen, skin tightening, skin lifting, help drug delivery. I just love microneedling. And now there are equipments which combine microneedling with radio frequency, which is even more fantastic. So I am a big fan of microneedling.
Yeah, because there's microneedling with the radio frequency. Those are treatments that you can use even on active acne, can't you?
Yeah, sure, you can. Yes.
Yeah, which is quite a rare thing to be able to do. I haven't tried one of those for a while because they're quite challenging, aren't they? You need a good deal of anesthesia going on in the face.
You do.
Yeah.
You do.
Okay, thank you. And what about other things you could do to support this area? Would you take energy treatments, the radio frequency and oil therapy and stuff around the mouth as well?
Why not? Yes.
Okay.
So one, I'd like to stage the lip on the area around, right? So I would like to work on the corner of the mouth, which is droopy. So I use a filler there. I use a filler along the jawline here to support it, because this is something what we call as a pre-jowl sulcus. And that tends to get obliterated, and it gets more enhanced, actually, more enhanced as you start growing older. So I like to build that first with filler and start coming upwards and build this whole corner of the mouth. And thereafter, maybe I use a little bit of toxin to get rid of the DAO, the muscle that pulls the corner of the mouth down. And then I would actually approach to work on the lip. Now, in all this, somewhere I can fit in the energy-based devices, like you said. It could be a focused ultrasound like an Altherapy. It could be a radio frequency monopolar like a Thermage, or any of your bipolar radio frequencies, or a microneedling with radio frequency, or any of your hydrating injections to just regenerate the collagen, hydrate, make the skin very youthful in that place.
Okay, thank you.